doctor, what is the best treatment provided for women who have PMS?
So PMS is called as Pre-menstrual Syndrome. So this is a syndrome where women suffer from a lot of physical, mental and emotional upheavals for a few days during their menstrual cycles, preferably say like 5 days to 11 days just before the menses. And these symptoms subside as soon as the menses start, that is the periods start. So this is known as Pre-menstrual Syndrome. So the cause for this may be due to hormonal levels, an imbalance in estrogen and progesterone levels in the body, or imbalance with the serotonin level. So these are all certain biochemical hormones that are present in the body. So an imbalance in this leads to this premenstrual syndrome. So if you might have also experienced, so a lot of women, have experienced it at some point in their life or the other, where they have mood swings and they have lower pelvic pain and they're very uncomfortable just prior to their periods.
Yeah.
And they just know that they're going to get their period. You end up shouting at people around you, or you're just overall stressed, you don't have proper sleep. So all these things contribute to premenstrual syndrome. So it's not just the physical pain, but it's also the mental and emotional factors as well. So this is premenstrual syndrome, and in 80% of the cases, it's mild. In 20%, it may be slightly more and may be called moderate. But in 10%, it is quite severe. So severe that maybe they may have to, use some kind of break in their day-to-day activities. And because of this, it may impair their career and their day-to-day life. Okay. So in case of mild to moderate premenstrual syndrome, we usually advise them to make lifestyle changes, like drink plenty of water, have a healthy diet, lots of fruits and vegetables, less of salt and sugar, avoid aerated drinks, avoid caffeine like coffee, tea, all those things around this period of time. Apart from that, they should have regular exercise. Yoga and meditation helps as well. So if all these things don't help them in some way or the other, then we can even give them some mild pain medications to decrease the pain. However, if it is so severe that they are not able to sleep, or it's impairing their day-to-day activities, and it's causing depression, and they are totally uncomfortable with their environment, then we may have to give them some medication, as in we have what is known as certain antidepressant medications called selective serotonin reuptake inhibitors. So these are medications which may help them to get their depressive symptoms under control, get their mood swings under control. Apart from that, the bloating sensation can be helped with certain diuretics, that is certain drugs which help to reduce the water content in the body, to reduce the bloating. So these can also be used. If all else fails, we know we do something called as cognitive behavioral therapy. So this is something that the psychiatrists do, where they kind of counsel the patient and make changes in their behavioral patterns in order to enable them to function normally. And like there are a lot of other nutritional or herbal supplements like evening primrose, saffron, all these things which are like ginkgo biloba, which are seem to help in premenstrual syndrome. But there's no definite proof in all these things. But however, a lady can use a combination of these to enable them to lead a better life.